Good afternoon. Thank you for joining us virtually today. I'm here with Monroe County's Public Health Commissioner, Dr. Michael Mendoza, as well as Dr. Paul Grayman from the University of Rochester Medical Center, and Dr. Emil Lesho from Rochester Regional Health. It's been a few weeks since we had our community COVID update. The last time we were all together, our case numbers had fallen precipitously and our vaccination rate was steadily rising. But COVID didn't go away. Dr. Mendoza and I thought today was a good time to bring everyone back together to give an update on where we stand and what we're doing. The Delta variant is at the top of everyone's mind. Nationally, we're seeing case numbers and in some cases hospitalizations rising quickly. And the Delta variant is making up an ever-increasing percentage of these new cases. Locally, we're starting to see our case numbers slowly rise, but they're still relatively low and relatively contained, and we haven't seen any significant increase in hospitalizations. However, we are concerned because we do not want to see these trends continue in the wrong direction. Starting today, we will reinstate our new case reporting every weekday so that the public can see what we see and understand exactly what's happening in Monroe County. Today, we will be reporting close to 70 new cases, which is our highest single day total in a while. We do not want to see this trend continue. As can be expected, the vast majority of these cases are among unvaccinated residents. And we're seeing these cases arise in situations which should sound familiar to all of us: indoor gatherings with no masks and unvaccinated individuals. Numerous cases have resulted from indoor maskless gatherings such as graduation parties, birthday parties. We've also seen a few summer day camps having issues as well. Kids under 12, as we know, cannot get the vaccine yet. And while these camps are working so hard to keep our kids safe, and even some of them have them wear their masks when they're indoors, all of the hard work and safe behaviors are negated at lunchtime or in the carpool with friends when masks come off and there isn't enough social distancing. Travel is also the source of new cases we're seeing. Either our residents traveling to places with higher infection rates or individuals from those places visiting friends and family here. So what can we do? We all want to keep our community healthy. And with the fall fast approaching, we all want to make sure our schools are able to fully open come September. So vaccinations continue to be the best tool that we have. The best way to protect yourself, to protect your family, and to ensure that our kids get back in their classrooms is to get vaccinated. The vaccine is safe, it's effective, and it's free. So please, if you're eligible and have not done so yet, please talk to your doctor, talk to your family, and go and get a vaccine. Without question, all of the mitigation strategies we can review or consider, the vaccine is by far the most effective. It works, and it will ensure we safeguard the health of our entire community. So with that, I'll turn it over to Dr. Mendoza, who will be sharing some additional details about what the Delta variant and what we're seeing locally.
Thank you, County Executive Bello, and thank you to my colleagues, Dr. Grayman and Dr. Lesho, for joining us here today. And thank you, as always, to those of you who in the media for continually providing critical information to our community during this pandemic, which, as we know, is not yet over. The good news is we are doing well when compared to many other parts of the country. It is not a secret as to why this is happening. We have a higher overall vaccination rate. So many people in our community have stepped up and have said, not here, not now. Monroe County is well ahead of the curve. Nearly 70% of those eligible to receive the COVID vaccine have had at least one dose, and 62% have completed their vaccine series. So it is reasonable for us to talk about September and fully reopening our schools. We want our children back in school full-time while keeping our entire community healthy and safe. So how do we ensure that this happens, even as we see the number of positive cases rising, as you heard? First and foremost, as the county executive said, we continue to get vaccinated because we now have the luxury of stopping this virus before it can close our classrooms or fill our hospitals, as it did last year and the beginning of this one. The vaccines work. They are free. And if you look at the people in our community and across the globe who are fully vaccinated, there is no question that these vaccines are far safer than getting COVID itself. Are the vaccines fail-safe? Of course not. No vaccine has ever provided 100% protection to anyone. But as Dr. Grayman and Dr. Lesho will tell you, vaccinated people are not showing up in the hospital, they are not on ventilators, and they're not dying. They are not as likely to be spreading it to other people who cannot yet get vaccinated, most notably our young children. or our family members who experience cancer, kidney disease, heart disease, or any of the numerous conditions that weaken our immune systems. Do some otherwise healthy vaccinated people suffer or even die from a severe case of COVID? Yes. But if you really take the time to look at the statistics, you will see how extraordinarily rare this condition is. Unfortunately, the same cannot be said for the unvaccinated. So before I turn it over to Dr. Grayman and Dr. Lesho, I'd like to take a few moments to talk about the Delta variant in particular, as we've been getting a lot of questions about this the last few days. While there is no way to get an exact percentage of positive COVID cases in Monroe County that can be attributed to the Delta variant, it is highly likely that a significant proportion of those cases here are from the Delta variant, given what we are seeing elsewhere across the region and across the country. But the variant causing outbreaks is far less of a concern to me than the outbreaks themselves. This is what I am focused on today. The vaccines are proving to be very effective against all of the variants that we are aware of at this time. So again, if you are eligible for the vaccine, now is the time to get it. With that, I will turn it over to my colleagues, Dr. Paul Grayman from the UR Medicine and Dr. Emil Lesho from Rochester Regional Health.
Well, if I can begin for the U of R Medical Center, as others have said, we're extremely pleased with the very low numbers of COVID patients in the hospital. Today and in recent days, we have fewer than 10 patients with active COVID infections in the hospital, in our hospital, and none of those patients are in the ICU or on ventilators. And that's the lowest number of COVID cases in our hospital since last summer, when things were at a very low level as well. So that's terrific, but we're worried about these increases in the number of cases in the community, because typically hospitalizations lag by a couple of weeks after people have infections in the community. So we're worried about what's to come. And that's the reason that everybody needs to get vaccinated. The vaccines work, they're safe. 180 million Americans have been vaccinated against COVID. And if there were serious problems with the vaccine, all of us would have been aware of those a long time ago now, that we've been using these vaccines in huge numbers of people. And amongst our own healthcare workers in the U of R system, about 82% are vaccinated. That's over 15,000 people. So your doctors, your nurses, the people who take care of you, and who are well educated in medicine and vaccination and the various risks that might be present, those people have elected to get vaccinated overwhelmingly. And that's what everybody else should do to keep us all safe.
Hi, I would like to echo the comments of all the previous comments of Executive Bello, Dr. Mendoza and Dr. Grayman, and encourage people who have concerns about the vaccine safety or vaccine hesitancy to discuss it with their trusted members, with their provider, because that's the main reason. That's the way we can get ahead of this and defeat it. As Dr. Mendoza said, what I am concerned about as well is not the variants themselves, but the pockets of unvaccinated people who allow the virus to infect, that permits the virus to infect people. And when a person is infected with the virus, it gives it a chance to mutate and morph. And that's how we get these variants. And experts have described pockets of unvaccinated populations as quote unquote variant factories. So the most important thing is to get vaccinated. We're seeing, we had a pause where to the happiness and the excitement of the healthcare workers at Rochester Regional, we went for several days without any COVID patients in the hospital or new positive cases. But unfortunately, recently we saw a little bit of an uptick. We have 1 to 2 patients right now in the ventilator, on a ventilator in the ICU. Again, all of the patients, to my knowledge, that are sick in the hospital are unvaccinated. We have recently 1 patient who was fully vaccinated, who tested positive and had mild symptoms. But I should reiterate that this was not unexpected because this patient was severely immunocompromised. They were transplant patients, and we had all agreed, the consultants, that had it not been for the vaccine, there would have been a much worse outcome. That patient is doing well, has relatively mild disease. I attribute to the vaccine. So thank you.
Great, thank you. Thank you, doctors, for that important, helpful information, for the work that you're doing in your teams in our healthcare systems. Our message today is clear. We must be vigilant as COVID prevalence is starting to increase, and we must continue to vaccinate. Slowly and steadily, we're making progress. As we've discussed, about 70% of eligible individuals in Monroe County have received at least one shot of the vaccine. That information, as well as the breakdown of vaccination rates by zip code, is available at the Finger Lakes Vaccination Hub website, which is located at www.flvaccinehub.org. So again, it's flvaccinehub.org. Monroe County continues to operate daily vaccine clinics across the community with an emphasis on locations in low vaccination census tracts. This week alone, we're operating in 13 different locations. We have a standing clinic Monday through Friday at MCC's downtown campus. We were at the RTS Transit Center yesterday, and we'll be back again next Monday. And later this week, we'll be at Ibero-American Action League, the Lincoln Library, and the Project Tips event, among other locations. All of our clinics are listed on our website at monroecounty.gov, and walk-ins are always welcome. You do not need to have an appointment. Our partnership with the Vaccine Hub, Common Ground Health, and other community-based organizations, like some of the ones I mentioned, are working tirelessly in support of these vaccine clinics. It's working to get ambassadors on the street, armed with educational information to help residents make a decision they're comfortable with. And it's working to ensure we're bringing our vaccine clinics to where people are most in need. It may be slow going at this point, but it is working. And I can't thank the team members enough for their dedication to this critically important effort. Because for now, our vaccine efforts in continuing to reach out to those not yet vaccinated is focused on how we will fight back against the slowly rising numbers. I've had a lot of questions over the last couple of days around the reinstitution of mask mandates and whether or not we would be mandating vaccine for Monroe County employees. Right now, we are not considering reinstituting a mask mandate in our community right now. We don't think that we're there at this point, and I'm also not considering a mandate at all for vaccination for Monroe County employees. We do not believe those steps are necessary now, and I don't anticipating them being necessary in the near future because I'm confident, I'm beyond confident in this community's ability to come together, keep everyone here healthy, and get our kids back in school full time in the next few weeks. And to do so, we have to get vaccinated, understand what works, what we know works, what the tools are in our toolbox, and keep everybody safe. So thank you. And with that, we'll throw it over to Julie, who can help manage questions from the media.
Thanks, County Executive. Our first question comes from Spectrum News.
Hi, this is Lowell Rose from Spectrum News. I know you just talked about that you're not looking at requiring a mask mandate nor requirements for vaccination for staff. What would be the threshold or the point that the county would have to issue a mask mandate countywide in vaccinations? I know the CDC is expected to announce today that they're looking at asking vaccinated people to be masked indoors.
So, well, it's a good question. I think one of the things that you have to look at is the prevalence of community spread and how it's spreading, out there. Right now, we're seeing a lot of clusters develop, which is when I said earlier that a lot of the positive cases we think are relatively contained through the contact tracing. We're finding them in clusters like that. And so one of the things we're going to look at very carefully is whether or not that trend continues and we see it contained, or do we start to see evidence of widespread community transmission. The other piece that obviously the doctors could weigh on, and if they'd like, is really how the variant spreads amongst those who are vaccinated and unvaccinated. And we're seeing if you start to see a high level of transmission even amongst the vaccinated population, that would have to be revisited, obviously.
Any concern? Well, I have two more questions, and I'll just throw both out. Do you have any concerns for the fall as far as masking for children? And then also when it comes for testing in the county, since things have opened back up, are you seeing testing rates drop? What are testing rates looking like? I know we're reporting 70 cases today. Do you think that's a true reflection of the community?
Yeah, so it'll be nearly 70 cases. I'll say this about the concern, and then others can weigh in on testing. I think that, I am concerned, and that's why we wanted to bring back our regular updates here. And we're also going to start to go back to daily reporting of what our numbers are. Our average number of cases had dipped down to just above single digits about a month ago. And we're starting to see that slowly increasing back up again. So I'm concerned. Dr. Grayman, I think it is, just said that, talked about hospitalizations. Those are always the lagging indicator. So you see what's happening in the community. First, it's, what is your vaccination rates look like? What are I'm sorry, not vaccinations. What are your positivity rates look like? What are the number of new cases that we're having? And then how sick are people getting and moving into the hospitals? But unfortunately, we don't see people in the hospitals until it's too late, right? And it's already spread. And it's, like I said, that's the lagging indicator. So we're already concerned. So we need to continue to raise the importance of vaccination in the community, help people understand the importance of being vaccinated, because we don't want to have to slip back into further restrictions like we're seeing in other places around the country where the vaccination rate is 10, 20%. I saw on the news this morning in other places in the country. So we need to keep our rates low. And I think the efforts are working. If you look at some of our zip codes that we've been focused on because they had lower vaccination rates, and 146 in the 13 over the last 2 months, the vaccination rate's gone up 9%. In 14611, it's up 6%, and 14608, it's up 8%. So that focus and targeting, I think, is making an impact in places that have low vaccination rates, and we just need to continue those efforts.
Okay, thank you. Our next question comes from WHEC. I'm not sure who's on. Go ahead.
Thank you, Julie. It's Berkeley Green here. Just give me one moment. Dr. Mendoza, the reports that I'm reading say the CDC is going to recommend that students from K through 12 wear masks in school this year. The state health department will make the rule on that. If you had the power to make that rule, what would you suggest happen in schools with masking this year?
Well, the reality is that we're not even close to the school year yet when it comes to looking at the timeline of these variants. The belief is that the Delta variant surge that we're seeing in other parts of the world and other parts of the country will be shorter lived than previous surges. So the hope is that it can potentially come and go in our community, if ever, before the school year starts. So I think we'll have to revisit this later on in August to see what exactly things look like on the ground before we can make any predictions. But the reality is that things are moving very quickly right now, and it wouldn't be wise to make a recommendation for school, which is still, a month away.
Do you think, Dr. Mendoza, in your experience, based on your experience over the last 20 months, do you believe the state health department is going to give the decision-making power to individual school districts, or are they going to just have a blanket policy across the state?
My hope is that they'll give additional authority to the local health departments, because we work more closely with the individual school districts than the state certainly does. I anticipate that something like that will come, but we have to wait and see what the state ultimately decides. And then at the end of the day, I think the school district will need to be in a position to make decisions based on the particulars of the vaccine rates, the case rates, their buildings, all the details that make each school building, let alone each district, different. I think we need to consider those. So what I'm hoping for is that we'll have additional ability to give recommendations here at the Monroe County Health Department, and my colleagues across the region are hoping for the same. But then ultimately that the schools will have the ability to make that call more independently of one another.
Thank you, Berkeley. Our next question comes from Jayne Chacko from 13 WHAM News.
Hi, my question is for in regards to children and COVID. Are we seeing an uptick of cases amongst young children between, I guess, 12 and up, and also under 12?
Dr. Mendoza, did you want to take that?
Yeah, I'll take that. So we just updated the county website dashboard today. We are reporting 53 additional cases, new cases today. If you look at the age ranges, certainly it's more common among individuals less than 20. We are seeing a significant number of people 0 to 9, and all of them are unvaccinated. But what we're seeing is really cases primarily in the age demographics where there are more unvaccinated people. Now, there are additional people who are older than that who are getting COVID. Most of them are also unvaccinated, but yes, we are primarily concerned with the youngsters who are not able to get vaccinated. And that's the reason behind our message today, which is to try to get as many people as eligible vaccinated so that we can protect those 0 to 11-year-olds who are not yet eligible to get vaccinated.
Thank you. And my other question, I guess for the hospital systems, is there any thoughts on mandating vaccines for hospital workers? Any decision?
Yeah, I can start with that. Currently, our position, our policy is that vaccination for COVID is voluntary. We want to see nearly all of our healthcare workers vaccinated. That is our goal. If we can achieve close to that goal with voluntary vaccination, that would be ideal. But we continue to evaluate this as we go forward. And at some point, we may have to make a decision that's different, that we would need to mandate vaccines. So it's something that potentially can happen, but for now, we're still in a policy of voluntary vaccination. We also have to consider with any kind of strict mandate, what effect that might have on our healthcare workforce, because a strict mandate might result in some healthcare workers leaving their positions. So we have to consider all the effects of a mandatory policy on the whole healthcare system and how we deliver care to all our patients who depend on us.
At RGH, at Rochester Regional Health, we're seeing very comparable rates of vaccination among the workers that Dr. Graham mentioned. We are not mandating them yet, but we continue to evaluate, the situation in real time on an ongoing basis. I will say currently we have undertaken more educational campaigns to try to encourage employees to get vaccinated, to meet with them through infection prevention, or anybody that, when they have question and answers for little mini town halls. So we're trying to encourage them to get vaccinated to boost the rates yet. So yeah, and we also together the healthcare systems, both healthcare systems try to maintain harmony of policies, and so we Dr. Graham and I are in regular contact to make sure we're on the same page and we're doing similar things at similar times.
Thank you. Next up is Sean Lehman from the Democrat and Chronicle. Sean?
Yes, hi, this is for Dr. Mendoza. You talked about clusters of outbreaks in the community, both among children who aren't eligible to be vaccinated, but also adults who just choose not to. I wonder if you can characterize how those two groups overlap. Are there adults passing this disease to kids? Is that primarily what's happening?
So again, it's a familiar story. It's household contacts, close contacts between unmasked individuals. So in the example of these camps and other public places, there are unmasked people who are largely unvaccinated who are interacting at a close distance for a prolonged period of time. So it's really not any different than what we've seen before. I do think the numbers are still low enough that we're not looking at community-wide transmission like we were several months ago. It's the reason why I'm optimistic that we can nip this in the bud if we can get our vaccination rates even higher. I think the reason that we're not suffering the current fate of Florida and Arkansas is that we have a higher vaccine rate. And so if we can continue on this path and keep that vaccine rate climbing, I'm hopeful that we can keep it away. But the reality is that we have to prepare given that the numbers are increasing at this point.
Okay, thank you. That's it for me.
Thanks, Sean. Raquel Stephen from WXXI News, you're next.
Yes, hi. My question is for the hospital systems. I know URMC reported 10 COVID cases, and RGH said one some in the ICU, I believe. Do we know the ages of these people that are being hospitalized, or the age range?
I don't have the ages of those who are hospitalized. I would say the experience in the last 2, 3, 4 months since vaccination has ramped up in the community is that the ages of hospitalized patients with COVID are lower than they were earlier in the pandemic. And I think that reflects the fact that the unvaccinated population is more heavily in amongst younger people. So I think that generally holds true, but I don't have the actual ages of patients currently in the hospital.
That's what we're seeing at Rochester Regional, a little bit of a younger trend, but generally they span all ages. You know, the one person that was in the ICU, from also those that test positive, it spans the age range, and it mirrors the proportion that Dr. Mendoza reports on his website.
Okay, and I have another question about masking for vaccinated. Dr. Mendoza, under what circumstances do you recommend people that are vaccinated wear masks, if there is any?
Well, I would first start by saying anybody who is vaccinated who wishes to wear a mask is certainly welcome to do so. I think that's a personal choice, and I think that's something that we should, again, not judge people who are wearing a mask for whatever reason. We're looking at the positivity rate, we're looking at the total case numbers, and again, like before, we're looking at trends. If we can attribute the majority of the new cases to known clusters and continue to stay out of community transmission, then I don't think it will be necessary for vaccinated people to wear a mask. Now, if we see additional evidence that there is spread in the community, knowing what we know about Delta being more transmissible, more contagious, then that will tip our hand in favor of recommending that. But we're not there yet, thankfully. I'd like to try to keep us from getting to that point. But if it ends up being that we have more widespread transmission for a more contagious virus, it will be probably necessary at that point to reconsider.
Thank you.
Patti Singer from Minority Reporter, you're up.
Thank you. It feels in a way like the band is back together, doesn't it? I have 2 sets of questions here. One of which is for County Executive Bello. You had mentioned that rates in some of the zip codes, vaccination rates, are up. We don't have anybody from the hub here to answer this question, but perhaps someone can. What are you seeing, though, is resistance and obstacles in some of these same zip codes where you are really trying to take the vaccine right to people, and it's still a bit of a difficult task that you have?
So it hasn't really changed over the last several weeks since we last talked about it. The biggest barrier, I think, to success here, it's around education. It's about answering questions about the vaccine. I think there's a lot of hesitancy around misinformation that exists out in the community. It's also about reaching people where they are. And removing barriers like transportation and other things to receiving the vaccine. And so I think those efforts that we made are, I think, having some positive signs now if you look at the increase in the vaccination rate, because we try to remove, starting with those 2 barriers. We tried to remove them. So first was working with transportation, making sure that we have the vaccine where people live. And so we have all those clinics that I said earlier that are located directly in those low vaccination areas, working with community-based organizations. So when you're working with people like IBERO, that's helping in the community there. So we're not asking people to come to us, we're coming to them. The second piece is with Common Ground. We don't have someone from Common Ground on here, but what I can tell you is that the Ambassador program is working well. and it's linked with those vaccination clinics. So when we're in a neighborhood working at one of those neighborhood-based vaccination centers, the ambassador program is linked to those to be out in the community, engaging with residents who live there to answer those questions that they may have and reasons that they're hesitant. So I think combining those two factors is making progress.
Thank you. And other questions for the doctors? We talked very early on about antibodies, but now that we have the vaccine, are the antibodies produced by the vaccine, are they the same or different than the antibodies produced from actual COVID? And is one set of antibodies perhaps more effective than the other set?
I think a way that my colleagues who are vaccinologists and virologists approach that is to simply say that the protection that you get from the approved vaccines, especially the mRNA vaccines, is a little bit better than the protection you get from natural infection. So we kind of want to dispel the myth, well, I'll just get COVID and that's a better way to protect myself. The vaccines are cleverly designed to enable you to respond to a broader range of antibodies, or of variants, if you will, of mutations. Whereas natural infection is a little more constrained, it's a little narrower. So, that's another reason why it's so important to get the vaccine. Also, if you think that you're going to, the route to immunity is through natural infection, you don't know if you're going to be one of those people who get severe disease or end up in the ICU or be what's called a long hauler. And just anecdotally, what we're seeing now again is that it seems like, we had so many patients when we had the prior two waves that although they were in the hospital, some patients had mild infections. It seems like, at least in my anecdotal experience, the few patients that we've had in the hospital that were unvaccinated had moderate to severe disease.
Thank you.
Thank you, Patty. And our final question comes from WROC. I'm not sure which journalist is on. Good.
I would say to the community, don't be afraid. We have control over what we can take in terms of precautions right now. We have the vaccine, it is widely available. We know what works, and so don't be afraid. We said it early on, and I'll say it again, facts over fear. We know the vaccine is highly effective, maybe even more effective than we had thought it would be in January and February. We have a highly effective tool to prevent this illness and prevent this spread, and to end this pandemic in the near future. Let's focus on what we know works and what we can do, and not be afraid of the things that we don't yet know.
That does it for questions.
Great. Thank you, everybody, very much.
Thanks, everybody.